The last topic of disaster management subject is epidemics. See, epidemics is related to disaster also. Even otherwise, epidemics is part of public health, so we have to study about it. This chapter is mainly about public health. So we will see not only about epidemic, but also we'll see what a pandemic is, what other disease outbreaks is. Okay, so based on the level of the disease occurrence, see, if somebody gets cancer, then it's just a disease which can happen in anybody. But if one particular area there are 100 people with same kind of cancer, then that means there's something wrong in that place which has caused the cancer. Either it is because of their occupational problem or because of the environment, something has caused that cancer. Okay, so like that, the level of disease occurrence in a place means that there is some cause or some vector which is causing the disease. So based on the number of cases and the type of cases, we can divide them into different categories. So that is what we are going to see, the level of disease occurrence and what it is called. So sporadic means disease which occurs infrequently and irregularly. That means it is not frequent, it is not regular. It just happens that somebody gets the disease and then there are 1,000 people who don't get the disease, then somebody else gets the disease. That means it's sporadic. It is not regular, it is not frequent. Okay, endemic means there is a constant presence of a particular disease in a particular population within an area. For example, I used to work in a place in Andhra Pradesh where people used to get cerebral malaria. See, in Tamil Nadu we don't get much of cerebral malaria, but in that place there used to be hundreds and thousands of cerebral malaria every year, especially after the rainy season. So that means the disease and the causative agent, which is the mosquitoes and the larvae, they are present in large numbers in that particular geographical area. So it is endemic. So that is endemic. Okay. The next thing is epidemic. Epidemic means there is a sudden increase or a sudden onset in the number of a disease more than what is normally accepted or expected. See, if usually in a particular community there are 100 cases of malaria, that means it is endemic. Every year there are 100 cases, but in one particular year there are 1,000 cases. See, 100 can become 150 or 200. That is acceptable. We can say this particular year it became more number of cases. But when it increases 5 times or 10 times, like from 100 it has become 500 or 1,000 cases of malaria, then we say it is epidemic. That means there is a sudden increase in the number of cases, much more than what is usually expected. So we say it becomes a epidemic. Outbreak is also very similar to epidemic, okay, but it is usually limited to a particular geographic area. That is, within a particular boundary, outbreak happens. And pandemic, on the other hand, is an epidemic that has spread to several countries. Okay, pandemics are not usually common. Epidemics are common, outbreaks are common, but pandemics have very rarely happened. Okay, sorry, I just pandemic means when the epidemic has spread to several countries or continents and affects a large number of people. Okay, we are probably one generation that has seen a pandemic. I don't know whether in the next 100 years we'll have a pandemic, but we never expected that we'll go through a pandemic. But here we are having the coronavirus pandemic. It has spread to several continents and countries within a short period of time and affected lakhs of people. We just miss cluster. Cluster is an aggregation of cases grouped in a particular place more than the number expected. Okay, that is a cluster. So let's see what pandemic is. Pandemic actually means, pan means all and demos means people. So pandemic means some disease which affects all people. It's an epidemic of infectious disease over a large area. Okay, it leads to disruption in the health, economic, and social lives of people, and it has a health cost, economic cost, and a social cost. Okay, so I'm not explaining too much about pandemic because we are going through it, and every day I think all the newspapers and television you are seeing about the various aspects of pandemic, and you know how healthcare systems are disrupted, you know how the economic system is disrupted, how the social society is disrupted because of this pandemic. Okay, it needs no explanation because we are going through it right now. If it had been last batch of students, they wouldn't have known what was a pandemic, but you all know. So it's a very sad situation that we are going through, the huge number of infectious cases in a population, and there are a lot of deaths also from pandemics. Okay, pandemics are sometimes man-made and sometimes natural. So this coronavirus, we can say it's partly man-made, partly natural, because whether it was artificially created we don't know yet, but we know that it came from an animal, and due to human consumption it started spreading. So it was from a natural source, and then it became a man-made disaster because it entered the humans, and humans started spreading to different places. There are several examples of epidemics previously, like the Ebola epidemic, the Zika virus which affected people in Kerala, avian flu, that is the bird flu. Then we have swine flu, we have cholera, dengue fever, malaria, yellow fever. These are all epidemics that keep coming on and off in various places of India and other countries, especially developing countries like Africa. So these are common epidemics. So let us see what is the role of each country in detecting an epidemic or a pandemic. First thing is the country has to establish monitoring systems. So public health, you already studied about public health, the government health system. So every government hospital as well as private hospitals should have a system where unique cases, or if there is a sudden increase in cases, they have to inform the government about it. Okay, so this monitoring system predicts and identifies infectious disease threats at the local level, at the district level, at the community level, and at the national level. So whenever there is an increase in cases, the government can take adequate steps, and it will help. There should be countries' ability to quickly and accurately collect, analyze, and use public health information should be strengthened. Okay, and then lab scientists, veterinarians, health prevention experts, they should be able to identify and contain outbreaks in humans and animals before they start spreading. Okay, so people have to be trained. Lab scientists have to be trained to identify new viruses and bacteria. Veterinarians, because animals are a source of lot of viruses and bacteria, so veterinarians have to be involved in identifying new bacteria or virus which can spread to humans. And then if any of these viruses or bacteria are identified, they have to be tracked and then identified, and the outbreak should be contained as early as possible. Okay, and then one of the most important aspects of identifying these kind of microorganisms, viruses, bacteria is the laboratories. Okay, what are the laboratories? Laboratories are nothing but laboratories are places where tests are done. Okay, every hospital has a laboratory, but a normal laboratory, they do biochemical tests, pathological tests. But for handling viruses and bacteria which are very virulent, that means they can spread easily, cause a lot of damage, the lab should be having various tiers. Okay, the National Board of Laboratories, Accreditation Board of Laboratories, called NABL, it gives accreditation, or it recognizes laboratories at different levels. They are called biosafety levels, BSL. Okay, so there are BSL level 1 lab, BSL level 2 lab, BSL level 3 lab, BSL level 4 lab. Okay, so based on the type of bacteria and virus they handle, if it's very risky, only the extremely high labs which have all the facilities and preventive aspects, they are given permission to handle such viruses and bacteria. Okay, so they have biosafety level 4. That means they are extremely safe, and there is a very little chance of the bacteria or virus escaping from a laboratory. See, I'm emphasizing on this because there is a lot of talk about coronavirus having come out of a laboratory in China. Okay, whether it is true, we don't know, but people are saying it escaped from a laboratory. That means, in spite of the safety system, the virus went out of the lab and started affecting people. So that is why the safety of the laboratory is very important, and tiered laboratory, that is level 1, level 2, level 3, level 4. So level 1 can be present in many places in a country, level 2 very few places, level 3 still more less, level 4 will be only 2 or 3 labs in the whole country will be level 4. That is, they have high safety, a lot of precautions and safety measures are there, so they can test only high risk samples. Okay, so all this will help in preventing coronavirus kind of diseases. It will prevent pandemics and epidemics, and it will also help in identifying pandemic or epidemic at an early stage. Okay, so finally we'll come to the response or control of a pandemic or epidemic. Okay, the first thing is public health emergency operations. Once a pandemic or epidemic has occurred, what should the government do? What should the health system do? They should have emergency operation center, where a central location they respond to the crisis. So it's called the crisis center, or the place from which they communicate to all the hospitals, all the other areas. See, during a war time, we have something called as a war room. So war room is the place from which people communicate to all the other people around the country and manage the army people and others. So similarly, during a health emergency, we should have a emergency health operation center from which they communicate to all the districts, all the relevant areas where disease is occurring. So that is the first step, to establish a public health emergency operation center. Then we should develop technical expertise and capacity. That is, the country should have people who have knowledge to treat the people affected by a particular disease. See, when coronavirus first came, there were very few people who knew how to treat the disease, but slowly we see that all over the country there are newer methods of treatment being followed. They are trying out different methods of prone position, ventilation, oxygen giving, and using different kinds of masks. And then so all these newer techniques will develop when a pandemic or epidemic occurs. That will help in treating the people. Then public health emergency management people have to be trained. So during a pandemic we are facing it, but even when there is no pandemic, we have to constantly train doctors and nurses, paramedical workers in how to diagnose and treat people when a pandemic occurs. Okay, so that they are ready and prepared to face the situation when an epidemic or a pandemic occurs. Okay, I hope you understand. Even when there is no pandemic or epidemic, we have to train the people so that they are equipped and ready to face the situation if a pandemic or epidemic arises later on. Okay, then we also have to establish and strengthen rapid response teams. That is, they will quickly respond to any disease outbreak. Okay, see, within 5 days there will be hundreds of flights, hundreds of trains, and thousands of people will travel from one city to another state. So if we do not work in a rapid response manner, one disease or one person who is infectious can spread the disease to thousands and thousands of people. They can spread to thousands more, and so within 5 to 10 days a disease can spread to millions of people. That is why when a new disease or new kind of virus, especially virulent viruses and bacteria, are identified, it is important that the rapid response teams immediately act and control the disease in a particular geographic area so that it does not spread to other areas. Okay, so that is the next response and control of a pandemic or epidemic. Finally, we'll have to develop, test and train on protocols for rapid identification of health threats. Okay, whenever there are uh, new diseases, there are health threats, and so we have to develop newer methods, test these methods, and train people on the protocols of using these methods, so that they are already in place, and they will help in reducing the spread of pandemic or epidemic. Okay, so with this we have finished disaster management, the whole subject. If you have any doubts, please contact me through WhatsApp. All the best for your exams. Thank you.